my name is Julia. I'm a nurse, and I'm a graduate nursing student actually in the AGMS, which is Advanced Generalist Master's Program.
Hi Julia, nice to meet you.
Hello. And what would you like to be addressed as?
I'm George.
Okay, George. And are you familiar with advanced practice nurses?
I think I've heard about that.
Okay. I did just want to inform you that an advanced practice nurse is a registered nurse such as myself, and we're just able to treat patients, diagnose them, and prescribe medications because of the education background. Okay. And just so you know, this interview will take about 30 minutes. All the information is confidential, and if you have any questions, feel free to ask.
Sounds good.
All right. So we'll start by your biographical data. What are your initials?
JP,
And what is your date of birth?
March 24, 1969.
What is your address and phone number?
11076 West Avenue, Wheaton, Illinois. And my phone number is 312-451-6161.
Okay. How old are you?
I'm 55, about to be 56.
And what sex were you assigned at birth, and what is your gender identity?
Man, for both.
Okay. Who is your primary healthcare provider, so your regular doctor?
Doctor's name is Anita Bednarz and provider is Dewey.
Okay. And who is providing this information for you today? Do you consider yourself, for example, a reliable historian? Do you remember most of your health history?
Oh, yes, sure.
Okay. What is your marital status?
I'm married.
Okay. And what is your usual occupation?
I'm civil engineer.
Are you currently employed?
Correct, yes I am.
And have there been any job changes due to health reasons?
No.
Okay. In general, what brings you in today?
This is just for annual checkup.
All right. And now we're just going to move on to the history of your present illness and your health status.
Sounds good.
When was your last exam?
About a year ago.
Okay. And was it a routine visit or was it for a specific concern?
That was just regular annual checkup.
All right. And how would you say your health has been since that last visit?
About the same, maybe slightly improving. But since I don't have any big health problems, that's about the same.
Okay. Do you have any chronic illnesses or significant past illnesses?
Nothing special, no.
Okay. And do you have any concerns about your current health or well-being?
No, I feel pretty good.
Okay. Now for your past medical history, are you up to date on your immunizations? And just to list a few, we have like the Tdap, flu vaccine, COVID vaccine, pneumonia, hepatitis B, and then the TB test, which is called PPD.
I don't think I have anyone except I used to have COVID probably in 2022. That was the only one I had.
The COVID vaccine, okay. And do you remember if you had just a single COVID shot like the J&J, or did you have something that's an mRNA vaccine with the 2 injections?
It was single one, yes.
Okay.
J&J.
Alright. And have you had any exposures to communicable diseases recently, like tuberculosis, COVID, or hepatitis B, which is spread by like blood or fluids?
Never to those, just COVID, but it was back into 2022.
Okay.
Nothing since then.
And do you have any allergies to medications, foods, or environmental factors?
No, none I would know.
Okay, and just specifically making sure no allergies to penicillins or latex?
No, I don't have problems with that.
Have you been hospitalized or had any surgeries or emergency visits?
Not lately.
And in your general life, have you ever been hospitalized?
Just once in my life when I was 2 years old.
Okay. And what would you say that was for when you were 2 years
I
old?
had the left foot surgery, and that was the only reason I went to the hospital.
Okay.
They took me to the hospital.
And ever since that surgery, everything has been fine?
Correct, yes.
Okay, good. And have you had any major injuries or any accidents?
No, thank God, no.
Are you currently taking any medications? Those can include prescription, over-the-counter, supplements or herbs?
Nothing permanently. Supplements from time to time when I feel like taking them.
Okay. What supplements do you take from time to time?
Usually I go with vitamin C when I feel a little cold or that I'm getting cold or something like that. I take vitamin C for 2 days, like 3 times a day, and that's about it.
And how big of a dose would you say? Like how many milligrams?
One pill is about 1,000 milligrams, so I take like 3 pills during the first day and the second day, and this is it.
Okay. And do you use any complementary or alternative therapies like acupuncture, chiropractic, oriental medicine, any special diets, vitamin therapies, or prayer?
No, nothing at the moment. I used to use, yes, most of them, but not at the moment.
Okay. And for your family history, what are the ages and health statuses or causes of death for? Now I'm going to ask for specific people in your immediate family. So for your grandparents.
My grandparents, my grandfathers died from cancer, I believe. My grandmothers died from heart and vein problems, and my father died from cancer, and my mom is still around.
Okay. And do you remember what kind of cancers your grandfathers passed from?
Grandfathers, I don't recall. My father passed from the liver cancer, which started from colon cancer.
Okay. And now, in regards to, I know you mentioned your father. Did you mention what your health status is of your mom?
My mom, she's 92, and lately she had problems with her backbone, and of course she had other problems connected to heart, and but she's still here. Yeah, she's still in moving condition. Yes.
And do you remember what ages your grandparents and your dad passed at?
My dad passed at 72, and my grandparents in their 60s. Except my grandmothers, they lived until 186, I believe, and one around 80.
Okay. And now how about the health statuses of your aunts and uncles?
They are in pretty good condition all life and doing pretty well. Still active professional.
Okay. And is there, do you have a big family? Like, is there a large variation of age?
Yes, there is a big variation of age, and most of them, I would say 80%, are doing great. There are some line of my ancestry which didn't do that well, health wise. But most of the family is fine.
Okay. And do you have any siblings?
I do. I have older brother and older sister. I mean, yes.
Okay. And what are their ages, and are they doing well?
Oh, I can't tell, but they are. My brother is older, I believe, 8 years from me, and my sister 13 years. Okay. They're fine. I think they're okay. It's still working.
Okay. And now, in regards to your children, do you have children?
I do have 3 children, 2 daughters and 1 son.
Okay, and how old are your children? My
older daughter, she's about to be 33, and my younger, she's gonna be 30, and my son is 25.
Okay. And now, as for your spouse,
she's still young. She's 55.
Okay. And she's in good health?
She's in good health, yes. Decent health.
All right. And just in general, are you concerned about any illnesses in your family?
Nothing particular. I mean, we are doing pretty good, and except the deaths we had in the past, we're pretty fine at the moment.
Okay. And now, just in regards to specific conditions, I'm going to name these conditions, And you just tell me yes if this runs in your family,
Okay.
and if it does, just say who has
Okay.
had this condition. Allergies,
No, nobody.
asthma,
My father's brother had asthma problems, but due to his work conditions, except than that, no one else.
okay. High blood pressure,
My mom had, yeah,
heart disease,
heart disease. My mom and my father,
stroke,
none, no one,
diabetes,
and no one.
cancer.
And my father,
And you mentioned your
and
grandfather's.
grandfathers, yes.
Okay. Thyroid disease.
No one.
Any blood disorders?
I don't think so.
Any obesity?
My mom is a little overweight, but except than that, no, nobody.
Okay. Vision or hearing problems?
No.
Any genetic or congenital diseases like birth defects?
No.
Any neurological problem like seizure disorder?
No.
Any mental illness such as depression, anxiety, bipolar disorder, schizophrenia,
No.
anything like that? Any cognitive disorder or learning disability?
No.
Any behavioral issues?
No.
And any substance use disorder, and that includes like alcohol and illicit drugs, cigarettes?
No drugs. My father used to smoke a lot. And of course, in the country when I was born, and having alcohol more often than they should, it wasn't a problem. So, yeah, maybe connection with the alcohol, but not like problem. It wasn't a problem.
Okay. And now, in regards to the personal and social history, who lives in your household?
Myself, my wife, and our younger son.
Okay. And tell me about your work history, just overall.
Okay, well, after schools, I started working as a professional land surveyor, and I was doing that for probably 5 years. And then in the meantime, I was going to college for the civil engineering degree. And after that, I started working as a civil engineer, and that's what I'm doing till now.
Okay. And have you had any job-related health risks like a violence exposure or environmental risk?
No.
And how do you feel about your financial situation? Do you feel like it supports your healthcare needs if you have any?
Yes, I think, yes, the financial situation is pretty good.
And do you have any insurance coverage for your primary doctor or hospital visits?
I do, yes.
Okay. What is your highest level of education?
I have a bachelor degree.
And do you use alcohol, tobacco, caffeine, or any other substances?
Caffeine, yeah, once a day, about 6 ounces of coffee in the morning. And tobacco, never, ever. And alcohol, maybe once every month or 2 weeks, I'll have a glass of wine.
Okay. And what are your sleep patterns? Do you sleep regularly?
Pretty regularly, I would say. I go to bed around 10 p.m. and wake up around 6-ish.
Okay. And do you have any sleep disturbances, like any insomnia? Or
No, I sleep pretty well.
Okay. And now in regards to exercise, do you exercise?
I do exercise and on a pretty regular basis, like at least 2 times a week, doing aerobic and weights for about 40 minutes, I would say.
Okay. And this, you said it's pretty regular throughout?
Yes,
okay.
Minimum twice a week.
Good. Okay. And then can you describe what you ate in the last 24 hours?
I think I can do that, yes. I had a bagel and a cream cheese yesterday for breakfast. And then around 1 p.m. I had sushi for lunch. And then some hot cocoa and Swiss cheese and some bread for the dinner. And this morning I had nice breakfast sandwich, and for lunch I had tuna salad sandwich.
Okay, that Sounds like a pretty solid diet.
Mhm.
Do you have any special diets that you like to follow?
Not really. Actually, I try to follow less carbs diet and trying to stick to that.
Okay. And do you eat out a lot, like going to restaurants or fast food joints?
Actually, no, we don't go to eat a lot. Sometimes we go to breakfast. We love breakfast and go on the weekends to breakfast place, maybe once a month, twice a month the most. And most of the meals we're having at home.
Okay, good. And now with your stress, how do you manage stress?
Pretty well, I would say.
Okay. Have you ever looked for any help for stress-related issues or mental health concerns?
No, never had problems with that.
Okay. And have you ever witnessed or been a victim of violence or abuse?
No.
Okay. Now in regards to the safety and environment, do you use seatbelts when you're going to drive? Like
Always,
bike helmets?
yes. Always,
Okay.
yes.
And any other safety measures that you take?
No, just simply when I like motorcycling, so I always wear full gear when I ride motorcycles.
Okay, good. In your home, do you have a functioning smoke and carbon monoxide detector?
I do, yes.
Okay.
Several of them.
And are there any guns in your house?
Yes, I do have guns and I have safe and I keep them in there.
Okay. Are you exposed to any environmental hazards at home or at work, like pollution, secondhand smoke, lead, anything like that?
It's pretty good. Work environment is very good, professional.
Okay. And now with your religion and cultural considerations, do you have a religious affiliation?
Yes, I'm Orthodox Christian.
Okay. And do you have any religious or cultural beliefs that might affect your health care?
Yes, sometimes we're having Lents, which is staying away from the meat and dairy products for a period of time and focusing more on prayer and doing good things, good deeds. And that helps to put you back on track.
Okay. And now we're just going to go through what we call a review of systems. So it's like an assessment a doctor would do on you from the head to the toe.
Okay.
But I'm just going to go through each individual system and I'm going to list some symptoms and concerns. And you just let me know if you're having any positive symptoms or concerns from what I mentioned, okay?
Sounds good.
So we'll start with just generally. Do you have any fevers, chills, fatigue, night sweats, or any weight changes?
No.
Okay. And is it at your current weight, is that what is preferred for you, or would you prefer to lose weight or gain weight?
Actually, it's pretty stable. It's recently I lost like about 5 pounds, but I gained back a little bit.
Mm-hmm.
So it's like it's slightly moving. 2 pounds up, 2 pounds down. Over several months. So I'm pretty comfortable with the current weight.
Okay. And do you have any pain?
No.
Would you rate your pain as 0 from a scale of 0 to 10, 0 being no pain, 10 being the most?
0.
Okay. For your skin and nails, do you have any changes to your skin? Any concerning moles or changes to your nails where you might have like a discoloration, fungus, any problems there?
No.
Okay. Do you use sunscreen regularly?
Sometimes, for example, in Mexico, but not around here in the States.
Okay. And in high sun exposure, do you try to kind of cover with like a sun pad and all of that? Okay, good. Now for your hair and scalp, do you have any hair loss?
No.
And do you experience any dryness or itching of your scalp?
No.
Okay. Now for your eyes, do you wear any glasses or contacts?
Only when reading and working.
And when was your last eye exam approximately?
About a month ago.
And do you have any vision issues?
I just simply need glasses when I read or work.
Okay. Nothing in particular?
Nothing in particular, no.
And with your ears, do you have any hearing loss, any ringing of the ears, or any infections?
No, my hearing is really good.
Okay. For your nose and your sinus, do you have any congestion, any sinus pain, or nosebleeds?
I don't.
And for your mouth and throat, do you have any dental problems currently?
No.
Do you have a sore throat, any swelling problems, or issues with taking care of your teeth?
No.
Okay. Do you floss and brush your teeth regularly?
I do, and on a regular basis I'll go for checkups to dental office.
Okay, good. And now for your neck and lymph nodes, do you have any swelling? Excuse me.
Sure.
For your lymph nodes, do you have any swelling, any lumps, or any stiffness of your neck?
No.
Okay. For your chest, do you have any lumps, any pain, or discharge from the nipples?
No.
For your lungs and your respiratory system, do you experience any coughing, any sputum, so that's like a thick mucus, shortness of breath, or any asthma?
Nothing like that.
For your cardiovascular system, so that's your heart and your blood vessels, do you have any chest pain, any high blood pressure, or high cholesterol?
No.
Okay. For your gastrointestinal system, that's your stomach and your abdomen, your intestines, do you experience any nausea, any vomiting, constipation,
Never had
diarrhea?
problems.
Do you have any bleeding from your rectum?
No.
Okay. And now for your urinary system, do you have frequency, do you need to urinate often? Do you have problem urinating, or do you see blood in your urine?
No, I don't. I don't need to wake up at night, for example. I just go normal basis in the morning and before going to bed, maybe during the day whenever I feel like. But it's normal, nothing special.
Okay. And do you have any issues holding in your urine?
No.
Do you have any pain in your flank area, which is just like the middle part of your back?
No.
Do you have any infections in the urinary system?
No.
And do you have any abnormal discharge?
No.
Okay, and are you circumcised?
No.
Now for the reproductive health, I know you mentioned you have 3 children, grown children. Do you have any fertility concerns at this time?
No.
Okay. When would you say your last prostate exam was?
I don't think I ever had one per se, but I don't have any problems with prostate.
Okay. And your sexual history, what is the current or lifetime amount of partners?
Just
you've had?
one.
Okay. And do you currently use any contraceptives?
No. At the moment.
All right. And now for your musculoskeletal system, do you have any joint pain, any stiffness in your muscles or joints, or
No.
any issues with movement?
No. Everything works pretty well.
And now we'll move to your neurological, so just like your head and your brain, your thinking.
Okay.
Have you ever had any head injury or loss of consciousness?
No.
Okay. Have you ever had a coordination loss where you feel kind of like off balance?
No, I never had something like that.
Okay. Any dizziness that you're experiencing?
No.
Any numbness or tingling, like maybe in your hands or feet?
No, never had.
Any seizures or tremors?
Never had some.
Do you get any headaches?
Very rarely. I mean, I don't even remember when was the last time.
Okay. They don't take over your day where you're not able
Oh
to
no,
focus,
absolutely
right?
not. No.
Okay. Any cognitive impairment or issues with your memory?
No.
And are you ever irritable or have mood swings?
No, I feel pretty good. I'm pretty happy.
Okay, good. Now with the system, it's a hematologic endocrine. Do you experience any anemia? So this is just inability for your blood cells to carry oxygen.
No, I feel pretty energetic.
Any bleeding tendency, like where you have trouble stopping bleeding after you get a cut or anything? No. Have you had a blood transfusion in the past?
I don't think I had.
Any thyroid problems?
Nothing I would remember.
Are you ever sensitive to temperature changes like hot and cold?
Not really.
Do you have polyuria where you're urinating a lot and you just feel like you keep needing to go?
No, I never had that.
Okay. How about conditions called polyphagia or polydipsia where you feel like you don't feel relieved after urinating?
I don't recall I had any symptoms like that.
Okay. And now with your psychiatric, with your mood? I know you mentioned your mood's pretty stable, no mood swings
feel
or.
pretty good. I don't have any mood swings.
Okay. And just in the past or present, have you had any mental health issues? And I'll just name a few: anxiety, panic disorders, depression, mood swings, hallucinations, suicide attempts or ideation.
No, never had anything like that.
Okay. Any eating disorders?
No, trying to eat healthy, and that's about it.
Okay. And you've never been treated for mental health issue?
No, never.
Okay. And is there anything else about your health that concerns you at this time?
Not really. I'm just coming for annual checkup just to keep happy my insurance. That's about it.
Okay. All right. Well, thank you for your time, and this information will help guide your care.
Thank you so much. Thank you.